everyone. It's been 3 weeks since my surgery, and I'm just going to cover a few things that happened after the first week of surgery. Uh, it's actually my second time recording this because I noticed that if I don't focus on speaking in front of a mirror, I noticed that my right side moves differently and it causes my mouth to be a little uneven. I think it's just I'm still trying to get used to how to speak. And this side, if you notice, my right side is a little bit more swollen from the beginning. It's always been more swollen. So I think the way that my muscle is moving right now, it's causing my right side to move differently, I guess. So I just have to focus a little bit more on moving my lips a certain way. That's why I keep looking to the right because I have a mirror, but so that it'd be more even. And part of it is just me trying to enunciate a little bit better, and I have more movement, or more, I don't know how to explain, but I can move my left side better than my right side because it's still very swollen. So after the first week, unfortunately, I was able to find an infection, a small infection behind, on the bottom, the lower right of my jaw. So what happened was, I think, it was very swollen, and I'm assuming that some of the mouthwash didn't get all the way behind. So there was a little infection. I went to the doctors. He said it was okay. It was very superficial, so they gave me antibiotics, and currently it's been resolved. I only had to take it for an additional week. And what else? I just had to make sure it was really clean. So it was a little bit more work and a little bit of a setback. But overall, it's now resolved and the wound is closing up. I also had a little bit of bone exposure, and the doctor said that could happen. My surgeon said that could happen. And how it resolves is new gum just grows over it. And I thought that was pretty cool because I had no idea that it was possible. And he didn't want to close it back up. I think it just an infection made the wound, I guess, pop open. But it just, he didn't want to close it back up because, of course, didn't want to, in case of infection, they wanted to drain it out. That's the first thing that I wanted to address. And I know that, these things could happen and there is a risk. It happened. But now it's resolved. So I want to address some of the numbness. Of course, I still feel numb here, and I feel numb here. I could actually feel a lot more on this side, but I think because of the swelling on the right side, it feels more numb. But there's tingling and needles and pins. I have all sensations. I feel everything on my upper lip. It's just the gums up top, my whole palate up top is numb. I can't feel anything. And the surgeon said it might take a year, or I don't know if it'll come back. But there's numbness here. There's still very numb here. Numbness and tingling all around here. But, yeah. So I'll just show you my side profile. And then the other side. So I'm very happy with the results so far, and I think it's just gonna keep getting better, and the swelling will just go down day by day. What else? Let's see. Types of food that I've been eating. So after the bands were removed, um, I was able to open my mouth a little bit, or after my mouth was, open from being bandaged shut. I was able to open just one, like almost one finger. I have these elastic bands on that kind of just maintains my bite for now. So I've been eating just anything that I could drink, mainly soup. I've been eating oatmeal and drinking smoothies probably every single day. That's all I could stomach at this point. And it takes a lot to eat, and you could become very tired easily. So I think drinking is a little bit easier for me at this point. Let's see. So since the 1 week post-op, I started walking and doing just minimal stretching and not doing anything too strenuous. And I am able to work out again after 4 weeks. So I have 1 more week to go until I could actually do a little bit of lightweight working out. And I'm supposed to get my splint removed. I still have my splint, as you can see, for another 3 weeks. And once that's removed, I could go to my orthodontist and have a stronger, I guess, thicker wire for the top jaw. And then I could start to chew soft foods. And the surgeon said he'll give me some exercises to do for my face. But I think that's pretty much it so far. In terms of pain, I'm not really much in pain anymore at this point. I think it's mainly sore, and it gets fatigued when I try to open my mouth to eat a little bit. The surgeon said I could open my mouth, but only using, my facial muscles, and that's pretty hard. What else? So I'll keep you guys updated once the splint is removed, and I'll show you, progress photos when the swelling goes down a little bit more. Thank you for watching. Bye.